Hello and good evening, everyone. So, welcome to another live session on the Ultimate Revision series, which is exclusively for the first year BDS students. Okay, so for the first years, now you know that like less than 30 days remaining for your examination, and this is the last lap. So, this is the time that you should be focusing more on your studies and do the revision more. So to help you with that, Eden2 has come up with this Ultimate Revision Series program where we will be discussing some of the most important and frequently asked questions from the university examinations, exam question papers. So we had already done a live class on the dental histology. Now today we are mainly going to focus on the dental anatomy topics. Okay. So dental anatomy is comparatively a little bit difficult when compared to dental histology. Like in dental anatomy, like you have to remember lots of factual data. If you look at the chronology or if you look at the anatomy of the tooth also, you have to like remember lots of like factual data. Okay, so that can make it a little bit challenging for some students. So in dental anatomy, we will discuss some of the very important and frequently asked the essay questions and the short essays in this live session. Okay, so if you look at the DADH examination, you can usually there'll be like two essay questions. Okay, one is from dental histology and one is from dental anatomy. Okay, so in the dental anatomy, usually what they ask is like mainly about the anatomy of a particular tooth. Okay. And commonly asked question is the molars. Okay. Either the maxillary molars or the mandibular molars. Okay. That's like frequently asked questions. And sometimes they can ask about the canines, maxillary canines, and the difference between maxillary and mandibular canines. First premolars, very important, and the mandibular second premolars also important question. And then about the incisors. Okay, central incisors and the maxillary central incisors and the mandibular central incisors, they are rarely asked, but still there is a chance for that in the upcoming university examinations. Okay, so these are the main important teeth that you should focus on. We had already done a live session discussing about the maxillary and the mandibular molars. You can access that video under the live session of this Eden2 YouTube channel. It's already there. Okay. Now today, like away from the frequently asked questions, we are going to discuss something that is important and that is like frequently asked in the last 5 years or so, but not the like the usual morphology or the anatomy of the tooth. Okay, this is something other than that we are going to discuss. These questions were asked even in the PG examinations also. Okay, so we are going to discuss that today. So one such important question is the differences between the deciduous and permanent dentition. Okay, so if you look at the last 5 to 7 years, these differences between deciduous and permanent dentitions were like a frequently asked question. And one time it came as an essay also, like 1 or 2 times it came as an essay question also. Okay, other than the usual morphological aspect of the tooth, this differences between deciduous and permanent dentition had been asked as an essay question and lots of time as the short note question also. Okay, they can either ask you like what is the difference between the deciduous and permanent dentition, or they can ask something like what is the difference between primary and the secondary dentition. Okay, so let's discuss about that today. Okay, so if you look at the dentition in various animals, okay, dentition means the types of dentition. Okay, these types of dentition can be classified based upon its succession into three types. Okay, the three types are, first one is monophyodont, then the second one is diphyodont, and the third one is polyphyodont. Okay, so in mammals, okay, in mammals you can generally see, okay, in animals, in the animal kingdom, you can generally see mainly these three types of dentitions. Okay, the first one is the monophyodont, second one is the diphyodont, and the third one is the polyphyodont. Okay, so what do you mean by this monophyodont? Okay, in this monophyodont type of animals, what we were able to see is that there will be only one set of teeth that is present throughout their lifetime. Okay, that is throughout their lifetime, they will have only one set of teeth. They have to take care of their teeth throughout their lifetime. Okay, if this set is lost, then it will not be replaced by a new set. Okay, so such kind of dentition is called as the monophyodont type of dentition, and this is most commonly seen in whales. Okay, not all whales have teeth, but the whales with teeth usually have this monophyodont type of dentition, and also in like moles, like that insectivores kind of animals, also you can see this monophyodont type of dentition. Okay, then the next set of dentition, that is the diphyodont. Okay, diphyodont, the main example is the humans, apes, and the monkeys, and everyone, they have the diphyodont type of dentition. Okay, just like what we see in our lifetime. Okay, we have two sets of dentition. Okay, till 6 to 7 years, we have the primary teeth, or which is also called as the deciduous teeth, or the milk teeth, or the lacteal teeth. Okay, so that is the first set of teeth. Now, after like 6 to 7 years, what happens is that it will shed, and a new set of tooth will come into our oral cavity. Okay, that is called as the permanent teeth. Okay, so such type of animals are called as the diphyodont type of dentition. Okay, this diphyodont type of dentition, example, main example, humans, monkeys, apes, and all are like typical examples of diphyodont type of dentition. Okay, now coming to a third type of dentition. Okay, that is the polyphyodont type of dentition. Okay, in this type, this is not commonly seen in the mammals. Okay, it is most commonly seen in the reptiles and the like the animals like the mice and all. In those species, it is most commonly seen. So in the polyphyodont type of dentition, what happens is that the teeth are continuously replaced throughout life. Okay, so if one set of tooth is lost, it will be like immediately replaced by another. Okay, so this is very important for this type of animals, because their mode of like attacking the prey and eating the food, and it is like very much essential for their survival also. Okay, that's why these teeth are like continuously getting replaced in such type of animals. Okay, so they are called as polyphyodont. Okay, so we humans, we are mainly diphyodont, and we have two sets of teeth. The first one is the primary set, and the second one is the permanent set. Now, if you look at the primary set and the permanent set, there is like huge differences between both sets of dentition. Okay, so let's see today what are these differences between this primary and the permanent dentition. Okay, so for explanation purposes, we can divide this primary and permanent dentition, the differentiating features, into three categories. Okay, first one is the general features. Okay, so what are the general differences between the primary and permanent dentition? Then the morphological differences. Okay, in the morphological differences, we will be discussing about the crown separately and about the root separately also. Okay, and at the last, we'll come to the histological differences. Like there is differences in enamel, there is difference, histological difference in dentine, there is difference in the cementum. What are all those differences? We'll be discussing separately. Okay, so first we will look at the general differences between the primary and the permanent teeth. Okay, so the first one is the number, the most prominent one, the number. You can see the number is actually 20 in primary, and it is like 32 in the permanent dentition. So 20 means 5 in each quadrant, and 32 means 8 in each quadrant will be there. Okay. Now the types of teeth. Okay. In primary dentition, you will not see the premolars and the third molars. All other teeth will be definitely there. That is the central and lateral incisors, canines, first and second molars. Okay. In case of permanent teeth, you will have two premolars in addition, and also the third molars also will be present. Okay, so because of this change in the type of teeth, there will be definitely change in the dental formula also. So if you look at the dental formula, you'll be able to see it is like I2 by 2, C1 by 1, M2 by 2, and so totally in one arch, you'll be able to see 10 teeth. Okay, whereas the permanent tooth dental formula will be a little bit different. It will be like 2 by 2, 1 by 1, premolars 2 by 2, and molars 3 by 3. Okay, so remember this dental formula for primary and the permanent teeth. So totally it will be like 16 in number in one arch. Okay, and look at the size of this primary and the permanent teeth. Okay, it's very evident. The primary dentition have like very small tooth because the jaw is small. Okay, jaw is only developing in the primary period. So the tooth will be definitely very small, whereas in the permanent dentition, the jaw is like somewhat developed. So the teeth will be somewhat bigger in shape. Now, Let's look at the next feature, color. Okay. So in color, you can see that in this picture, this central incisors and this central and one lateral incisor are permanent teeth. Okay. And the other teeth are like deciduous teeth. Okay. So you can see the color differences from this picture itself. Okay. In this picture, you can see that the primary teeth are like really white in color. Okay, they are also called as milky white in color. Okay, this is because the enamel, the outermost covering, the enamel is less mineralized, so it will be opaque in nature. Okay, so the underlying color of the dentine is not much reflected outside. Okay, that's why it's like purely milky white in color. Okay, whereas this is the permanent teeth. Okay, this is the newly erupted permanent teeth. Okay, in the permanent teeth, you will be able to see that it is somewhat like yellowish white in color. Okay, why this yellowish white in color? Because the enamel is more mineralized and it is translucent in nature. Okay, so because of that, the underlying dentine color is getting reflected very prominently. Okay, that's why it is somewhat yellowish white in color. Okay, so from this one image itself, you can see the color difference between the primary and the permanent teeth. Now, the placement in the jaws. Okay, this placement in the jaws is extremely important because primary teeth are placed perpendicular. Okay, perpendicular means at 90 degree. Okay, the teeth are placed, if this is the alveolar bone, then the teeth are placed like upright at the angle of 90 degree in the jaws. Okay, whereas in case of the permanent teeth, they are placed in a oblique manner. Okay, they will be like either not like straight line or perpendicular line like this, but they will be like somewhat inclined lingually or towards buccally. Okay, so this inclination is usually seen in the permanent teeth. Okay, now if you look at the eruption, uh, the primary teeth erupt somewhere between the 6 to 8 months after birth, and it is usually completed by the 30 months. And permanent teeth, they will start erupting by around 6 to 7 years of age and completes by 25 years. Okay, the last teeth to erupt, uh, third molars. Okay, this third molars, they usually erupt by around 25 years of age. So the eruption gets completed by 25 years. Now, coming to the root formation. Okay. Now, the primary teeth have like very small roots. So after eruption of the tooth, it just takes 1 year to complete the root formation. Okay. So for the primary tooth, after eruption, it just takes 1 year to complete the root formation. Okay. But in a permanent tooth, okay, since it has a more complex nature of the roots and it is more long. So what happens is that in the permanent dentition, usually the root formation is completed after 3 years of eruption. Okay, so it takes around 3 years to complete the formation of the roots in the permanent dentition. Now, if you look at the shedding, okay, shedding, likewise, we said the primary teeth, they're usually shed by 6 to 7 years of age. Until 10 to 12 years, there will be like shedding of teeth will be there. Whereas in permanent teeth, no shedding. There is the lifelong tooth, we don't shed it. Okay. Now coming to the crown morphology. Okay, if you look at the crown morphology, okay, just look at the crown of the primary and the permanent teeth alone. Okay, so what are the differences that you see in the primary and the permanent crowns? Okay, so this crown, the primary tooth crown will be more bulbous in nature. Okay, they will be like more like bulb shaped. Okay, why this bulb shaped? Because their cervical constriction here, right? This is the cervical constriction here. The cervical constriction is like very marked in case of this primary dentition. So their crowns will appear somewhat like bulbous and like very prominent in case of this primary dentition. Whereas in our permanent teeth, it is not, the cervical constriction is not that marked. So the crowns don't appear that bulbous in nature. Okay. Now coming to the dimensions. Okay. So if you look at the dimensions of the primary and the deciduous teeth, here you can see in this image the dimensions between the primary and the secondary teeth. The primary teeth is usually wider mesiodistally and in comparison to the crown height. Okay. Compared to the crown height, it is usually wider mesiodistally. Okay. Whereas in case of the permanent tooth, it will be like it has a narrow mesiodistal width, and but the crown height, it will be more in case of the permanent teeth. The crown height is more when compared to the width. Okay. Now coming to the surfaces. Okay, what are the surface changes that are seen in between the primary and the permanent teeth? So if you look at this, this is the in the anteriors of the primary teeth. You can see that the facial surface. Okay, so this is a facial surface. It is usually flat. Okay, you can see that it is usually flat above this cervical ridge. Okay, cervical ridge will be somewhat curved, and after that, this facial surface of this primary incisors will be usually flat labial surface. Whereas if you look at the permanent teeth, it will be usually convex in nature. Okay, so that curvature is seen in the permanent teeth, but not in the primary one. Okay, so that's one of the features. Next is the mamelons. Okay, those mamelons are nothing but they are just small finger-like projections that are seen in the incisal edges of the anterior teeth. Okay, especially the incisors. Okay, so these mamelons are not present in the primary teeth, whereas they will be present like around 2 to 3 mamelons will be there in case of the primary incisors. Okay, after some time, what happens is that because of the occlusal wear and because of the continuous grinding in between the food and the teeth, what happens is that the mamelons will disappear gradually in the permanent teeth also. But like immediately after the eruption, you can see like 3 or 4 just small finger-like projections on the incisal surface of the incisors. They are called as the mamelons. Okay. Now coming to cingulum. Okay, cingulum. The cingulum will be very prominent in case of the primary teeth. You can see the prominent cingulum here. Okay, whereas in case of the permanent teeth, it will be less prominent. Okay, so this cingulum, this prominent cingulum, it like occupies like 1/3 of the crown length in case of the primary teeth. Okay, so if you look at the lingual surface of most of the primary teeth, the cingulum is like utilizing most of the area of this primary teeth. Okay, now if you look at the cusp, okay, let's look at the cusp in the posterior teeth. So the cusp will be usually short, sharp, and pointed. Okay, remember the 3 names. It will be usually short, sharp, and pointed. Okay, whereas in case of the permanent teeth, it will be usually blunt cusp will be seen. Okay, now because of this short and the foci will also be like less prominent. So the occlusal surface of this primary teeth, they will be usually shallow in nature. Okay, the occlusal surface of this primary teeth will be usually shallow in nature, whereas in case of the permanent teeth, the cusp are like blunt, but the ridges and foci are like very prominent. So that will make the occlusal surface look very deep in nature. Okay, so that's the main difference between the primary and the permanent teeth. And if you look at the occlusal area also, in the occlusal area, if you see the buccal and lingual surfaces, they converge more. Okay, because of the more amount of convergence, what happens is that the occlusal area that is seen in the primary teeth is like very narrow. Okay, not much occlusal surface will be there because the convergence is more, so the occlusal surface will be less. Whereas in the permanent teeth, the not much convergence are seen, so the occlusal surface area will be very prominent, very wide also. Okay, you can see it from here. Okay, narrow the occlusal table, whereas it is very wide occlusal table is seen in the permanent tooth. Now, coming to the next crown morphology, contact area. Okay, that's very important. Usually in primary dentition, around like 75% of the children, there will be like something called physiological spacing is seen between the tooth. Okay, physiological spacing means no tooth are like contacting each other. Okay, there will be space between each tooth. Okay, so this is like a compensatory mechanism to prevent the crowding in the future permanent dentition. Okay, so usually this is seen in around 75% of the population. Okay, like there will be spacing in between the teeth, but if the tooth is contacting, then this contact area will be placed more gingivally. Okay, more in the towards the gingiva. This contact area is seen more towards the gingiva. Okay, whereas in the permanent teeth, this contact area is usually seen in the junction of the middle and the incisal third. Okay, somewhat here at the center of the tooth. Okay, so this is the junction of the middle and the incisal tooth. Okay, so usually you will be see the contact area somewhat here. Okay, now if you look at the cervical line, it is less curved in case of the primary dentition, whereas it is in the case of permanent dentition, it is more curved. Okay, so the cervical ridge is like very prominent in case of the primary teeth, and it is less pronounced in case of the permanent teeth. Okay, this is the cervical ridge here. Okay, here it is like very prominent, whereas here it is like less prominent. And look at the cervical constriction of it. We had already seen about the cervical constriction. The cervical constriction is very marked. That's why the crown of the deciduous teeth, they look like very bulbous in nature. Whereas in the permanent teeth, it will be like the constriction is less pronounced. So that's why it is not that bulbous in nature. Okay, so that's all about the crown morphology. Okay, in the crown morphology, we had discussed everything from the occlusal surface to the contact point to the occlusal table area and everything. Okay, now coming to the root. Okay, what is the differences in the root morphology between the primary and the secondary teeth? Okay, so if you look at the length of the root, definitely the primary will be like shorter and slender, whereas the permanent teeth will be long and strong in nature. Now, crown to root ratio. Okay, so the crown to root ratio, the roots are proportionally longer compared to crown size. Okay, the crown is like very small and the roots are comparatively longer, proportionally longer compared to the crown size. Okay, usually like 1:2 ratio is seen for the primary dentition, and as for the permanent dentition, it will be like 1:1.5 crown ratio is usually seen. Okay, now coming to the inclination of the root. Now, if you look at the apical third of this primary teeth, there will be a 10-degree labial inclination will be there. That is, at the apical third of this primary tooth, it will show an inclination towards a labial side. Okay, a small inclination towards a labial side, like around 10-degree inclination around the labial side is usually seen in case of the primary teeth, whereas in permanent teeth, there will be no labial inclination like that. Okay, now if you look at the furcation, okay, so this is the multi-rooted tooth and this is the furcation area, the junction of the multi-rooted tooth, that is called as the furcation area. So this furcation area is like very much close to the cervical line in case of the primary tooth. Okay, see this is the cervical line and this is the furcation area. Okay, like it is very close. It is very much close. Okay, whereas if you look at the permanent tooth, you can see the difference here. Okay, there is like 3 to 4 millimeter difference between the cervical line and this furcation area. Okay, so there is something called as root trunk. Okay, so this root trunk is like very prominent in case of this permanent teeth, whereas the root trunk is not so prominent in case of the primary teeth. Okay, so that's the main difference. And next, another typical difference that is seen in the primary tooth is the flaring of the roots. Okay, flaring means they'll be like little bit divergent like this. Okay, why divergent? Because underlying permanent teeth, okay, they are making way or they are making space for the underlying permanent tooth to erupt. Okay, so this is the primary tooth and the roots are flaring or divergent in nature. So why divergent? Because there is this underlying permanent tooth is there. Okay, so it needs space to erupt. So the tooth are flared so that the underlying permanent tooth crown can erupt and resorb this area fully. Okay, so that's why this flaring of roots is seen. Now, coming to the pulp morphology. Okay, now if you look at the pulp morphology, there is like prominent changes in the pulp also. So the pulp chamber is like very large in case of the primary teeth, whereas it is like relatively small in case of the permanent teeth. And the pulp horns. Okay, these pulp horns are like they extend more incisally or more occlusally here. Okay, so you can see that the pulpal horns here are like pointing more towards the enamel area, whereas it is like less pointing towards this enamel or the dentinal surface. Okay, so this is very important while preparing the cavities for the in the primary tooth. Okay, so if a child comes to you with a caries in the deciduous teeth, deciduous molar, then you should be very careful while preparing the cavity for that child because there are chances of exposing this pulp very easily. Okay, so you should be very careful while preparing the cavities for the child patients. Okay, now next is pulp canal. Okay, so in the crown region, the pulp is called as the pulp chamber, whereas in the root area, it is called as the pulp canal. So the pulp canal is more wide and tortuous in case of the primary teeth, whereas it is like narrow, like very slim and narrow in case of the permanent teeth. Oh, okay. Now next is the accessory pulp canals. Accessory pulp canals means other than the main pulp canal, there will be like a small extensions of this pulp canal. So these accessory pulp canals will be more in the furcation area. Okay, here in case of the primary tooth. Okay, so the accessory pulp canals will be more in the furcation areas in case of the primary tooth, whereas it will be more in the apical region here in the apex region in case of the permanent tooth. Okay, so that's the main differences between the pulp morphology of the two teeth. Okay, you can see the differences from here. Now, next is the histological differences. Okay, so if you look at the histological differences, there are differences in the enamel composition, there is differences in dentine, there is differences in cementum also, and there is difference in the dentino-enamel junction. So let's see what those are. So in the primary teeth, the enamel is usually thin and it has like uniform thickness. Whereas in permanent, it will be more thick and varying thickness enamel is seen. In case of the primary teeth, it is usually less calcified and more permeable. Okay, less calcified and more permeable. That's why we see like more type of caries in the children. Okay, like the rampant caries and all those widely spread caries are seen because of this less calcified nature of this primary teeth. Okay, and the it is more permeable also, so it allows bacteria to enter into the tooth very easily. Okay, whereas in permanent tooth it is more strong, more calcified and less permeable. Okay, now there is like difference in the direction of the enamel rods in both the primary and the permanent teeth. Okay, so in the primary teeth, if you look at the direction of these enamel rods, they are like placed horizontally like this. Okay, at the cervical region, they are placed horizontally like this alone. Okay, but in case of the permanent tooth, what happens is that these enamel rods are placed a little bit towards the apical region. Okay, they'll be like downwards like this. Okay, so this is also an important thing while making the cavity preparation. Okay, so while making the class 2 cavities, like in the proximal side cavities, in case of caries in the proximal side, then you should be very careful regarding the direction of the enamel rods also. Okay, so coming to dentine, in the primary tooth, it will be usually thin and variable thickness is usually seen. And usually we can see increased thickness near this occlusal area here. Okay, this occlusal area here. Whereas in case of the permanent teeth, it will be thick and like uniform thickness is seen for the dentine in the permanent teeth. Okay. Now there is something called as neonatal line. Okay, so what is this neonatal line? Okay, so let me show you the diagram here. This like prominent line here. Okay, that is the neonatal line. Okay, so all the hard tissue depositions in our body, like the deposition of enamel, deposition of dentine, deposition of bone, all those deposition of cementum, all those things, those depositions doesn't happen at a stretch. Okay, so what happens in this hard tissue deposition is that there will be like area periods of activity. Okay, so the cells will be like actively secreting this hard tissue, and then they will rest for some time. Okay, so there will be period of activity, then there will be period of rest, then again there will be period of activity, then again there will be period of rest, then again there will be period of activity, then again there will be period of rest. So because of this only, so many incremental lines are seen in the hard tissues of our body. Okay, so if you look at the bone, if you look at the enamel, if you look at the dentine, if you look at the cementum, there are so many incremental lines like this. This is because of this nature of deposition of the hard tissue. There will be periods of activity and there will be periods of rest. Okay, so that's why lots of incremental lines are seen. Now, one prominent incremental line that is seen in the enamel, that is called as this neonatal line. Okay, so what this neonatal line is that usually the first evidence of calcification of this deciduous teeth, they happen in the uterus itself. Okay, in utero itself, the when the baby is inside the mother's womb itself, the first evidence of calcification starts. Okay, so mainly for the deciduous teeth. Okay, in case of the permanent teeth, only for first molars. Okay, only for first molars, this in utero calcification is happening. Okay, so what happens is that after birth, there will be like change in the environment and change in the nutrition supply for the newborn infant. Okay, so So because of that, there will be change in the pattern of deposition of the enamel before birth and after birth. Okay. So a prominent line will be seen in the enamel, that is for the enamel deposited before birth and enamel deposited after birth. Okay. So here, if you see, this is the prenatal enamel. That is the enamel deposited in utero. And this is the postnatal enamel. That is the enamel deposited after birth. Okay. And between these two, there is a prominent line that is seen. That is called as the neonatal line. Okay. So this neonatal line, we can see in the ground sections. Okay. So this neonatal line is like mostly commonly seen in the deciduous teeth, and in the permanent teeth only first molars. Okay. No other teeth. Only first molars will be able to see this neonatal line. Okay. So that is one major difference between the deciduous and the primary dentition. Now coming to the dentino-enamel junction. Okay, so if you look at the dentino-enamel junction, it will be more scalloped like this in the primary dentition, whereas it will be like still scalloping is seen, but less prominent in case of the permanent dentition. And next is the cementum deposition. Okay, cementum deposition is like thin in case of the primary dentition, whereas it will be thick in case of the permanent dentition, and you can see more cellular cementum getting deposited in the apical region in case of the permanent dentition. Okay, so that are some of the prominent differences between the primary and the permanent dentitions. Okay, now next, like frequently asked question, but we don't see usually lots of essay questions from this topic of occlusion, but like lots of short notes were asked from this topic of occlusion, especially the compensatory curves. Okay, the compensatory curves is like repeated 7 times from the year 2017 till now. It is like repeated like 7 to 8 times, very frequently asked. What are the compensatory curves? What is this overjet and overbite? What is this leeway space of Nance? What is the primate spaces? Okay, so these all comes under the topic of this occlusion. Okay, so we are mainly going to discuss this topic of occlusion today. Okay, so what do you mean by occlusion? Okay, so occlusion means it is the static and dynamic relationship. Static means at rest. Okay, that is what's mean by static, at rest, and dynamic means at motion. Okay, so the static and dynamic relationship between the occlusal surface of the teeth during function and parafunction. Function means mainly mastication and all those things. Parafunction means other things like the talking, like swallowing and all those things. So basically the relationship between the occlusal surface of the teeth during the function. Okay, so for description purposes, we had divided the stages of occlusion into 2 stages. One is the predentate stage, that is, tooth has not erupted into the oral cavity. So such thing is called as the predentate stage. And the other one is the dentate stage. Okay, so in the predentate stage, it is again divided into 2 types. One is the gum pad stage, that is only the gum pad of the newborn will be there. No teeth has erupted. And the other thing is the precociously erupted primary teeth. Okay, what do you mean by precociously erupted primary teeth? Means the primary teeth has erupted before their time. Okay. Usually the eruption time for the lowest deciduous central incisors is like 6 to 8 months. So sometimes like newborns are born with a new teeth, or sometimes what happens is that within 1 month of birth itself, you can see small teeth in the child's jaw. Okay, so that's what is called as the precociously erupted primary teeth. Okay, such teeth are called as the natal teeth and the neonatal teeth. Okay, now coming to dentate stage, usually the deciduous dentition, mixed dentition period, and the permanent dentition. Okay, so this primate space is something that we see in the primary dentition. Okay, in the primary dentition period, we usually see something called as this primate space. Okay, so if you look at the dentition of the child, okay, so this is the general primary dentition of a child, and as you can see, there are like lots of spaces in between the teeth. Okay, so this spacing is called as the interdental spacing. Okay, this spacing is seen in between all teeth, so it is also called in generalized interdental spacing. And this spacing is not something that is a disease or that is a pathology. Okay, this is normal and it is needed. Okay, so such spaces are called as the physiological spaces or the developmental spaces. Okay, now if you measure the spaces in between each tooth, it will be usually 4 millimeter in the maxilla and it will be usually 3 millimeter in the mandible. Okay. So why this spacing is needed? Because the jaw is growing, and like after 6 to 7 years, this tooth will be like shed, and they will be replaced by bigger permanent teeth. Okay, so to accommodate this permanent teeth, this spacing is very essential. Okay, so this based on this spacing, we can predict whether the future permanent dentition will have crowding or not. Okay, so based on that, they have predicted whether the future permanent dentition will have crowding or not. So if there is crowding in the primary dentition, then definitely there will be like 100% there will be crowding in the permanent dentition also. If there is no spacing, then maybe like 67% there are chances that there will be crowding in the permanent dentition. And if the space in the deciduous dentition is less than 3 mm, okay, if it is less than 3 mm, then there is like a 50-50 chance for crowding in the permanent dentition. If it is somewhere between 3 to 5 mm, then 20% sage. And if there is like more than 6 mm space seen, then there will be like no crowding seen in the permanent dentition. Okay, the permanent dentition will be completely all right. Okay, so that is what is called as the generalized interdental spacing in the primary dentition. Now, what are these primate spaces? Okay, these primate spaces, they are also called as the simian space or the anthropoid space, or it is also called as the Bowman space. Okay, so this primate space is seen in the maxillary arch and in the mandibular arch. But in the maxillary arch, this primate space is seen between the lateral and the canine. Okay, that is mesial to canine, this space here, see. Okay, that is the primate space in the maxillary arch. Whereas in the mandibular arch, it will be seen distal to canine. Okay, that is between the canine and the first molar. Okay, primate space is seen here. Okay, so sorry, the primate space in the maxillary arch, it is seen mesial to canine, and in the mandibular arch, it is seen distal to canine. Okay, this is all seen in the deciduous dentition only. That is one thing that you should remember. This is only seen in the deciduous dentition. Okay, so why these spaces are seen? So there is something called as ideal occlusion. Okay, so this ideal occlusion means what happens is that in the ideal molar relation, what happens is that this is the maxillary molar and this is the mandibular molar. So in the ideal molar occlusion, what happens is that this mandibular molar will be a little bit in front, and this maxillary mesiobuccal cusp will coincide or will rest in the mesiobuccal groove of the mandibular molar. Okay, so that is what is called as a ideal molar relation. Okay, you'll study more about this in your 4th year orthodontics and all. But here I'm just telling you a gist of what is there. Okay, so to achieve this ideal molar relation only, lots of spaces and lots of such these things are there, like the primate space, leeway space are all there to achieve this perfect molar relationship only. Okay, so in future what happens is that this mandibular molars, they will like go towards the front a little bit, and the maxillary molars will come and reside in the mesiobuccal groove. Okay, so these spaces are important. This is called as a primate spaces. Okay. Now next is the leeway space of Nance. Okay, what is this leeway space of Nance? Okay, so the in the leeway space of Nance, what you should know about is that the sum of the mesiodistal width of the primary canine and molars is larger than the sum of the mesiodistal width of the permanent canine and molars. Okay, so this you can see here, this leeway space of Nance is usually seen in the mixed dentition period. Okay, we had already talked about the primate spaces. The primate space is usually seen in the deciduous dentition, whereas this leeway space of Nance is usually seen in the mixed dentition period. That is, the incisors had already been shed and new incisors had been erupted, and the molars, okay, the permanent molars had also been erupted. Okay, so if you look at it, these teeth, okay, the deciduous canines and the first and second molars are in the process of shedding, and these premolars and the permanent canines are in the process of erupting. Okay, so if you look at the space that is utilized by these 6 teeth, you can see that the space between C plus D plus E. Okay, the space between the deciduous canines and the first and the second molars are usually more than the permanent canines and first and second premolars. Okay, so the C plus D plus E space is always more than that of the 3 plus 4 plus 5 space. Okay, that is the general idea behind this leeway space of Nance. Okay, so if you subtract these two measurements, okay, that is the total space that is utilized by the deciduous teeth and the total space that is utilized by the permanent teeth, then a little bit space here is seen, that is the remaining space. Okay, so this remaining space is called as the leeway space of Nance. Okay, so if you look at the general idea behind this leeway space of Nance is the deciduous teeth are utilizing more area when compared to the permanent teeth. Okay, so if you subtract the space that is required for the deciduous teeth from the permanent teeth, then there'll be like a remaining small space will be there remaining. So that space is called as the leeway space of Nance. Okay, usually in the maxilla you can see around like 1.8 millimeter of this leeway space. So in one side alone, you can see around like 0.9 mm. Okay, in the mandible, the space is a little bit more. Like usually you can see 3.54 millimeter per arch, and in one side itself, you can see like 1.7 millimeter space for the leeway space of Nance. Okay, again, this is also for the mesial movement of the molars to achieve this molar relationship. Okay, so the mandibular molars should move a little bit mesial side so that it will coincide with the mesiobuccal cusp of the maxillary molar will coincide with the mesiobuccal groove. So to achieve that relationship only, this leeway space of Nance and primary spaces are all there to help it. Okay. Now let's look at the compensatory curves. Okay, so these compensatory curves are very important. Repeated question. So these compensatory curves are nothing but it is the anterior-posterior and the mediolateral curves that pass through the incisal edges and cusp tips of the teeth in the dental arches. Okay, so either it can this if you are look at the occlusal part of the especially the mandibular teeth, you can see that all these teeth and the cuspal inclination of this teeth, they're not arranged in a flat straight line like this. Okay, they're not arranged in a flat straight line like this. Okay, they'll be always be curved in nature. Okay, a little bit curved in nature. That curvature is always so. This curvature is what is forming this compensatory curves. Okay, so this is present in the natural dentition itself. So there are three types of compensatory curves. One is the curve of P, the other one is the curve of Wilson, and the third one is the curve of Monson. Okay, so these are the three compensatory curves. You should remember the names: curve of P, curve of Wilson, and curve of Monson. Okay, so first we will see what this curve of P is. So this curve of P is nothing but it is an anterior-posterior curve. Okay, anterior-posterior curve means from here to here. So if you look at the side of the face from the anterior side to the posterior side, this curve is extending, passing through the incisal edges of the anteriors. Okay, here it is the curve, the red line, that is the curve. Okay, passing through the incisal edges of the anteriors, then the cusp tips of the canine and the premolar, buccal cusp tip of the premolar and the buccal cusp tip of the molars, and then it is extending into the ramus area. Okay, so this curve that is present, that is called as the curve of P. Okay, this curve is like first introduced by the first noticed by the Ferdin and Graf von Spee. That's why the name of the curve is based upon this person only. Now, in an ideal curve of Spee, what happens is that this curve of Spee will extend into the condyles. Okay, it will extend into the condyles and we can form an imaginary circle like this. Okay, we can form an imaginary circle like this. Okay, I hope you are able to view it in a 3D view. Imagine it in a 3D view. Okay, so this curve of P will extend into the condylar area and it will form an imaginary circle like this. And in this circle, usually the radius of this circle will be usually 4 inch. Okay, if the center of, and we can usually see the center of this circle at the crista lacrimalis posterior. Okay, so the center of this circle will be at the crista lacrimalis posterior. That is one of the anatomical landmarks that is present in the skull. And the radius of this circle will be usually 4 inch. Okay, so this is the curve of P. Okay, so this curve of P is now part of this circle. Okay, so this curve of spin is now part of this circle with a 4-inch radius. Okay, with a center at the fossa lacrimalis posterior. It is an anatomical landmark in the in the skull region. Okay, so that is what is known as the curve of P. So basically, you have to know that the curve of P usually it extends from the incisal edges of the incisal edges of the anteriors, then to the cusps of the posteriors, and it will extend into the ramps. Okay, so this curve is called as the curve of P, and it can form an imaginary circle with a 4-inch radius. Okay, that's it. Okay, now another thing, the important point about this curve of P is that this is the occlusal plane. Okay, so the curve of P will be a little bit curved like this, and this is the occlusal plane. Okay, so if you draw an occlusal plane like this, then the curve of P is like this. Then the distance between this occlusal plane to the curve of P, that is called as the depth of curvature. Okay, so this depth of curvature will be maximum at the second premolar region. Okay, that is around 1.5 millimeter. Okay, so it is maximum around the second premolar region, and it is like around 1.5 millimeter. Okay, so sometimes questions can be asked like the like for which tooth maximum depth of curvature at the curve of P is same. Okay, so that time you should be able to answer that it is the second premolar. Okay, around 1.5 millimeter. Now, next curve is the curve of Wilson. Okay, so in the curve of Wilson is nothing but it is a mediolateral curve. Okay, so curve of P is like anteroposterior, whereas curve of Wilson is mediolateral. Okay, so from this area to this area, it is extending. So it is known as a mediolateral curve. Okay, and it contacts the buccal and lingual cusp of each teeth. Okay, you can see the curve of Wilson here. It is contacting through the buccal and lingual surface of the each tooth here. Okay, so this is known as the curve of Wilson. Okay, so this curve of Wilson is like very important because this curve mainly occurs due to usually I have already told that the permanent teeth are not arranged perpendicular. Okay, the permanent teeth are not arranged perpendicular to the alveolar bone. Okay, they'll be like lingually aligned or buccally aligned like this. Okay, now if you see the lower molars, okay, that is the mandibular molars. These mandibular molars will be usually inclined lingually. Okay, they'll be usually inclined lingually. And if you see the maxillary molars, okay, the maxillary molars will be usually inclined buccally. Okay, that is towards the cheek side. Okay, the lower molars will be inclined towards the tongue side, whereas the maxillary molars, they'll be inclined towards the cheek side. Okay, so that is the general inclination in which the teeth are set. Okay, so in case of the lingual inclination, because of the lingual inclination of the lower posteriors, the lingual cusp will be a little bit like lower position when compared to the buccal cusp. Okay, since they are like a little bit lingually inclined like this, what happens is that the lingual cusp is a little bit shorter when compared to the buccal cusp. And in case of the maxillary teeth, if you see, the buccal cusp is a little bit buccally placed, so it will be usually higher than that of the lingual cusp. Okay, so because of this height variation only, this curve of Wilson is seen. Okay, so if you look at the curvature in the maxillary and the mandibular arch, usually in the mandibular arch, the curve of Wilson will be concave in nature, whereas in case of the maxillary arch, it will be usually convex in nature. Okay, convex in nature like that. Okay, so that is the main difference between the Wilson's curve in the both the maxillary and the mandibular arch. In the mandibular arch, it will be concave, whereas in the maxillary arch, it will be convex in nature. Okay, so mainly this curve is helps in the like it mainly helps in the determination of the mediolateral jaw movements. Okay, it's like the mediolateral jaw movements that occurs during the mastication process and all, that will be mainly explained based on this curve of Wilson. Okay, next is the curve of Monson. Okay, this is a very important curve. Actually, usually we don't call it as just a curve, but it is like the sphere of Monson, they are called. Okay, because it is forming a huge sphere connecting through some of the important landmarks of the skull. Okay, so this curve of Monson can be called as a combination of both this curve of P and curve of Wilson. Okay, so you should view this curve of Monson in a 3D way. Okay, then only you will be able to understand it. Okay, so Monson, what he did was like he drew a line from the incisal edge of the anterior in lower incisors to the condylar area, and here to the condylar area, and he connected the two condyles also. So he got an equilateral triangle. Equilateral triangle means the measurement of the three sides of the triangle will be same. Okay, the measurement of the three sides of the triangle is usually 4 inches. Okay, so from here to here it is 4 inches, here to here it is 4 inches, and here to here it is 4 inches. Okay, so an equilateral triangle is obtained. Okay, so he called this triangle Bonville's triangle. Okay, so this Bonville's triangle is the main basis for this curve of Monson. Okay, so in the Bonville's triangle, what happens is that he tried to like make it a 3D model in the skull region. Okay, so this curve of Monson, it passes through the incisal edges and the cusp tip of each mandibular teeth. Okay, so this curve here. Okay, so this curve here is the curve of Monson. Okay, it is passing through the curvature of the incisal tips and the cusp tips of the each mandibular teeth. Okay, it is passing through here like this. Okay, and if you draw a triangle from above it, okay, connecting the condyles and connecting the glabella. Okay, this landmark is very important. This landmark here, that is known as the glabella. Okay, so if you connect a line through the this curve and this curve and this triangle is here. Okay, then this glabella will be at the center of a circle. Okay, so we are again drawing an imaginary circle like we saw in the curve of P. Okay, so in the curve of P, we are drawing an imaginary circle like this, and at the center of the circle will be at the glabella. Okay, and here the radius will be same. Okay, again the 4-inch radius will be seen here. Okay, with the center at the glabella. Okay, so this curve of Monson is a part of this bigger circle. Okay, so that's what he is trying to explain here. And he says that usually when we chew or when we masticate, the masticatory forces, they converge at the center of the sphere, at the glabella. Okay, but that theory is later discarded. So this is the main idea behind this curve of Monson. Okay, so this curve of Monson is the curve that is extending from through the cusp tips and the incisal edges of all the mandibular tooth. Okay, and if you draw an imaginary circle, the glabella will be at the center and it will be a 4-inch radius circle like this. Okay, and remember about the Bonville's triangle also. Okay, so that is the main basis for this curve of Monson. Okay, so that is about the curve of Spee, curve of Wilson, and the curve of Monson. Okay, next we'll look at the overjet and overbite. Okay, these are like topics that are like exclusively seen in your 4th year subjects like orthodontics, but here we are just telling about this in a gist. Okay, because these questions were frequently asked in your previous question papers, so that's why we are discussing this in a very small manner. Okay, so these overjet and overbite are nothing but they are the parameters to assess the maxillomandibular relationship. That is how the relationship between maxilla and mandible is there. It will be determined with the help of this overjet and overbite. Okay, so here you have to see that overjet is the horizontal overlap. Okay, overjet is the horizontal overlap and overbite is the vertical overlap. So jet usually if you look at a jet plane like that, it usually flies for some time horizontally and then only it will go up. Okay, so remember that like that. Jet is horizontal, whereas the bite is vertical. Bite we will do vertical like this. Okay, so bite is vertical and jet is, it will fly for some time horizontally and then only it will take off. Okay, so remember this. That's an easy way to remember the overjet and overbite. Okay, so overjet is nothing but it is the amount of horizontal overlap. Okay, so this is the horizontal overlap. How much the upper incisal edge is overlapping the lower incisor labial surface. Okay, that is known as the horizontal overlap. So how much horizontal overlap is happening? That is the overjet. Okay, so usually the normal value is 2 to 3 millimeter. Now, overbite means it is the vertical overlap. Okay, so the amount of vertical overlap of upper incisors on the lower incisors. Okay, so this distance is the overjet, whereas this distance is the overbite. Okay, so the overbite is also usually normally 2 to 3 millimeter. We can tell this overbite in a percentage also, like we can also tell like the 30 to 40 percentage of the lower incisors are covered with the upper incisors. Like that also we can tell. So the normal value is again 30 to 40 percentage. Okay. Now what happens if there is like increased overjet or like there is increased overbite? Okay. So that also you should write, because usually for short essay they expect that also. At least you should know the names and the condition where you can see the increased overjet and increased overbite. Okay. So this condition here is the increased overjet. Okay. You can see that the lower incisors are here, but the upper incisors are a little bit more proclined. Okay, so because of this proclination, there is like increased overjet here. Okay, this is not 2 to 3 millimeter. Ideal is the 2 to 3 millimeter. This is like more than that. Okay, so that is why it is called as the increased overjet. Okay, then next there is something called as the overbite. Okay, in the overbite, there is like a deep bite. Okay, like increased overbite is called as a deep bite. Okay, so from this image, can you see any lower incisors? Okay, no, the lower incisors are like completely occluded by the upper incisors. Okay, you cannot see a trace of lower incisor in this image. Anything. Okay, so such type of bite is called as the deep bite. Okay, and there is something called as the open bite also. In the open bite, these upper incisors are not even occluding at the lower incisors. Okay, so such type of bite is called as the overbite. Okay, so if they ask about overjet and overbite, tell these two things. Jet is horizontal overlap, bite is vertical overlap, then the normal values, then abnormally, in abnormal situations. Okay, in abnormal situation, there will be like increased overjet, and in case of overbite, there are two abnormal conditions. One is deep bite, and other one is the open bite. Okay, you should explain about this. Okay. Next is because of like some time restrictions, I may not be able to like discuss all the high yield and important questions. So I was going through the previous year question papers, and I had like formulated a set of questions that will be helpful for you. Okay, these questions you should not skip at all. Okay, definitely look at these questions before going to the exams. Okay, because these questions are very important. For essay type, again, I told you about molars. Molars are very important, especially the first molars. Okay, maxillary and mandibular first molars, very important. And along with the molars, also read about the chronology part also. Okay, like when is the first evidence of calcification? When is the enamel formation happening? When is the root formation completing? When it's is erupting into the oral cavity? All those chronology part, you should be thorough regarding it. Okay, so the maxillary and mandibular first molars, very important. We had already discussed. Okay, we had already discussed it in one of our live session. You can see it on the live section in the Eden2 YouTube channel. Then next is the maxillary canines. Maxillary canines and mandibular canines, another frequently asked questions, and their difference also. Okay, what is the difference between the maxillary and mandibular canines? Also very important. Again, here also chronology is very important. Okay, you should know about when the eruption, when the first evidence of calcification, when the enamel completion and all are taking place. You should be really aware about. Then next to canines is the premolars, especially the maxillary first premolar and the mandibular second premolar. Okay, sometimes it can be asked as a essay question, or sometimes they can ask you in the short note question, like describe about the occlusal aspect of the molar. Okay, so that aspect alone can be asked as a short essay. Okay, and maxillary incisors and mandibular incisors, very rarely we see incisors, but incisors has also been asked in the previous year question papers. Okay, then the differences. Okay, know the differences between all the tooth, like mandibular tooth and the maxillary tooth. What is the difference? Okay, if there is first molar, what is the difference between mandibular and the maxillary tooth? If there is canine, what is the difference between the maxillary and the mandibular canine? Okay, always compare and study. Okay, then it will be easy for you, and you will be able to cover a lot of topic also. Okay, so I'll suggest you to compare and study. Then, like I told you, like one aspect alone can be asked, like describe about the labial surface of the maxillary canines. Okay, like that also questions can be asked. And if you look at the short notes, embrasures. Okay, this embrasures is a very important question. It is frequently asked and frequently seen in the short essay type. Okay, embrasures. Next is the landmarks of the tooth, like the cusp, ridge, foci, singular mamelons, grooves. All these terms you should be knowing, and you should not get confused with all these terms also. Okay, what is cusp? What is ridge? What is foci? What are the types of cusp that are present in the maxillary teeth? Okay, or in the mandibular tooth, or what are the ridges that are present in each tooth? Okay, you should be thorough regarding that. Okay, you should not miss that. Then next is the contact points. Okay, in the permanent dentition, what are the contact points? How many contact points are there? What are those contact points? And where is this contact area that is usually seen? And then the line and point angles. Okay, line and point angles is another important questions. It was asked in like not frequently, but still I saw this question in like 2 to 3 papers. Okay, line and point angles. Then a dental formula and the tooth numbering system. Tooth numbering system is like very important. Either they can ask like tooth numbering system or like one system alone. Like describe about the FDI system, describe about the Sigma de Palma notation system. Like one system alone also they can ask. Okay, so note these questions. These are like very important. Have a look at it before going to your exam. Okay, so that's all about the dental anatomy class today. So I hope it's clear for you. If you have any doubt, you can ask now, or like after the live has ended, put the questions under the video here. Okay, so put after the live has ended, then put the comments under the video. Then we will definitely answer those questions. Okay, so that's all about the dental histology and the dental anatomy live class. Okay, we will see about the other live classes. So all the best for your examinations. Do well. Good night.